Midazolam is the most commonly used medication in the emergency management of seizures. The preparation for midazolam is 5 milligrams in 1 ml plastic ampules. Although the plastic ampules are labelled for slow IV or IM injection, they can be used for intranasal, which means into the nose, or buccal, which means into the cheek. When midazolam is to be used in a community setting, for example in a school, early learning centre or a disability setting, it is important that it has been dispensed in plastic ampules. This is due to the risk of injury and the added complexity of drawing the medication up with a needle, which will be required if glass ampules are dispensed. It is also important to check that the plastic ampules contain only 1 ml of fluid to aid rapid absorption into the bloodstream. Midazolam is easy to administer, it works quickly, and it has a short duration of effect. It has an unpleasant taste, which may be noticed if administered buccally and the person still has some awareness. It may also cause a stinging sensation in the back of the nose, which may be felt if the person still has some awareness. Midazolam can be administered intranasally using a syringe and atomizer. A fine mist is sprayed into the nostrils from where it is absorbed through the mucous membrane lining the nose. Midazolam can also be administered onto the mucous membrane in the buccal space, which can be found in between the teeth and the inside of the cheek. If you puff your cheeks out, the puffed area is the buccal space. Place your tongue onto the inside of your cheek. This is the buccal space. The medication needs to be applied into this area for best absorption. Midazolam is administered either directly from the plastic medication ampule or via a syringe. Midazolam should not be swallowed, as it is not absorbed well through the stomach. In some Australian states and territories, midazolam is given via the intranasal drop method. A 1 ml ampule of midazolam will deliver approximately 18 drops when squeezed. If a person is prescribed midazolam via the intranasal drop method, the required dose will be dripped into the nose, 1 drop equally per nostril, into alternate nostrils until the dose is delivered. The person requiring midazolam would be positioned on their back, with their head tilted back during administration.